Hi, my name is Dr. Lorna Claydon. I'm one of the doctors here at SkinSpot Skin Cancer Clinic, and I'm also the Chief Medical Officer for MoleMap New Zealand. And I'm just made this little video to answer some questions that we really often hear in clinic, or myths that we hear from our patients quite often. We thought we'd make this little video for you just to clear up and provide information on skin cancer, risks and treatment and prevention. When we're talking about skin cancer, there are actually multiple types of skin cancer. There's the melanoma skin cancers, which many people have heard of. 2/3 of melanomas occur as new moles. The other 1/3 occur as changes in existing moles or spots. So one of the things you're looking out for is a change in a spot that you've known about for a while, or a new spot or mole appearing on your skin. Basal cell and squamous cell skin cancers tend to be new spots too, but often they don't have any of that brown pigment in them, so they can be itchy spots, bleeding, scaly, changing over time. We actually have a really good acronym to help people to identify things to look out for, and we call it the SCAN acronym. We say scan your skin in between your skin checks, and the S of SCAN stands for sore spots. So any spot that isn't healing within 6 weeks. If it's itching, bleeding, if it's tender, then it needs a check. The C of SCAN stands for changing. So that is any spot that's changing in its size, shape, colour or texture. So particularly if you're seeing more than one colour or more than one texture within a single spot. The A of SCAN stands for abnormal. We sometimes call it the ugly duckling or the standout spot. So when you look at your skin overall, many of your spots will look similar, and this is the one that looks different. It might be darker, it might be raised, it might just catch your eye for some reason. And it's often family and friends that point these out to us. They say, have you had that checked? Because it just doesn't look right. So those spots definitely need to be checked. And then the N of SCAN is new spots, particularly if you're over the age of 40. And that's because melanomas occur more often as new moles. Not all new spots are going to be a skin cancer, but it probably does deserve a check if you've noticed a new spot appear on your skin. The best sunscreen to use is SPF 50 or higher, and that will block out 97% of UVB rays. They're the ones that make our skin go brown or burn. An SPF of 30 is only a few percent less effective. But there's a big variable in how good we are at putting it on. And so if you're not very good at putting it on, if you miss a few spots, or you will have read about in consumer magazine and such like that, sometimes there's some variability in how effective sunscreens are. If you're not putting it on really well, you may getting half the level of protection. Now an SPF of 15 rather than 30 is significantly less protective. So I say to everybody, go for a 50. That way you've got a little bit more of a safety margin if you're not putting it on quite as thick as you should be, quite as often as you should be, or there's a little bit of variability batch to batch from the manufacturer. Yes, you can, and it's another thing that people often misunderstand. Windows are quite good at blocking out UVB, which makes our skin go brown, but it does a really poor job of blocking out UVA. Now, UVA is responsible for the aging of our skin, but also some of the skin cancers such as squamous cell skin cancers. So it is really important for people that are in front of windows a lot. So driving, whose office desk might be in front of a lovely open window, that you're still protecting your skin even though you might not be outdoors as such. There's a fantastic photo that does the rounds on the internet of a truck driver, and the right side of his face, which is closest to the side glass pane on the truck, is wrinkly and aged so much more than the left side of his face, which is in the shadow and the interior of the truck. And it's really a stark reminder of the effect of UVA on our skin. And when you show people that picture, they're pretty quick to pick up a bottle of sunscreen and start applying it when they're on long drives. So makeup with SPF isn't designed as a sunscreen, it's designed to help with sun safety, but where it's got a tint or colour to it, if you were to put it on thick enough to act as a sunscreen at the SPF level on the label, it would be a really thick application of the makeup, and most of us don't like that kind of aesthetic, so more often than not we're going much thinner with those makeup layers than we would do with sunscreen, and that reduces the level of protection that you're getting. So I would always say to people, put sunscreen on for sun protection and put makeup on for your aesthetic appearance. And if it's got a little bit of sun protection in it, that's an added bonus. It just increases the level of protection you've got. But don't rely on makeup as being your sole sun protection. So the frequency of your skin check is decided by your personal risk. So if you have a family member who's had skin cancer, if you've got a very fair skin type, if you spend a lot of time outdoors, if you've ever had a skin cancer or a funny looking mole removed, then you should think about doing at least annual skin checks. And for some people it's more often than that, it's 6 monthly skin checks. If you've had none of those risk factors at all, and your skin is really good, you're not worried about anything on your skin, then it's a really good idea as a young adult to get a baseline skin check done. And in that skin check, your moles as they are now are recorded, and it makes it so much easier for you to notice new spots or moles as they come along. So even if you're not in the high risk group, you should do a baseline skin check, and if you're in the high risk group, certainly at least annual skin checks. And then you'll be asked to monitor your skin in between skin checks, and that's where that SCAN acronym can be really helpful. It's all about the things that we do every day, right? So it's about timing your activities outdoors to be at the lower UV index times of day. It's also much more comfortable to go for a walk in the morning or the evening. But you know, when you're taking the kids to the beach, think about getting there a little earlier or going a little later. You're more likely to find a park, and they're more likely to be able to enjoy the sun in a safe way. Clothing is really important. I use clothing a lot to protect my family. If we're going snorkeling or at the beach, my kids are often in leggings and long sleeve togs because they don't really enjoy the feeling of sand attached to sunscreen, and using clothing is just a much easier way for me to manage their risk. Hats are super important. You can get skin cancers on your scalp, and a lot of people don't realize that. So the only real way to protect the top of your head is to wear a hat. And it does a great job of protecting your forehead and the top of your ears. I do say to people though, a hat is only giving an SPF protection of about 4 on the tip of your nose. So a hat alone isn't going to protect your whole face. You still need to use sunscreen with a hat. And a hat should be wide brimmed. That brim around the sides is really important for protecting our cheeks here. And it's such a common sight to get skin cancer because of baseball style cap wearing, which gives us no protection on the sides. We do a lot of skin cancer surgery on ears as well for the same reason. So make sure your hat of choice has a brim all the way around. There are some great hats now, surfing hats with clips so that they stay on even if you're in the surf, in the water. They're really easy to wear and easy to use. Long sleeve sun tops have really come a long way recently, so the fibres are really much lighter. You don't feel so hot when you're wearing them, and they'll come down over the back of your hands with a little thumb loop. I use a long sleeve sun top when I go hiking because it's really hard to stay on top of the sunscreen application when you're working hard hiking and you're sweating a little bit, and I find that clothing does a better job of protecting me in that situation, and it does a great job of protecting the back of your neck too. So it's a factor, it's all of a combination of those different factors: sunscreen, hats, clothing, timing and exposure. There's really no safe level of UV exposure. There are safer ways to expose yourself to UV light, and there are more unsafe ways. So we need a little bit of UV light in order to make vitamin D, which is a really important vitamin in our systems for general health and well-being. But actually the New Zealand sun is so strong that even if we wear sunscreen and even if we use sun smart behaviour all the time, most people in New Zealand can get enough vitamin D in about 8 minutes without any additional steps, and that's despite wearing sunscreen, because we're so terrible at putting it on, and the sun is so strong here that we make vitamin D despite our sunscreen applications. Your exposure to UV accumulates over your lifetime. So your chances of getting skin cancer increase over your lifetime because that accumulated exposure. So the more you can limit that exposure, the less the chance that you're going to spend your later years of your life having regular skin cancer surgeries and treatment because of that early exposure. And you know, it's not that difficult to prevent some of that exposure. So, you know, if you like to go out for a walk, do it early in the day or at the end of the day. Avoid that midday 10 till 4 time frame when the UV index is at its highest. You know, put your sunscreen on every day. Even if you don't think you're going to the beach or going to be outdoors, we get a lot of damage just from those small moments when we're outside, going to the mailbox, hanging out the washing, walking down to the shops, picking the kids up from school. Use clothing to protect your skin, so slightly longer sleeves, a wide brim hat to protect your ears and the top of your head, thinking about things like that all the time and just building into your day-to-day routine. Oh, look, if there's one message for parents, it's that sunburn in younger people is really serious. So a blistering sunburn in somebody under the age of 20 can increase their risk of melanoma 2 or 3 times. So we want to go all out to prevent that from happening. It's not just something that happens at the beginning of the summer and then your skin's fine for the rest of the year. It's really bad news. But I also totally recognise that it can be hard for parents to get their kids to use sunscreen, particularly when they get into their adolescent years. So you need to model good sun behaviour, which is wearing a hat, applying sunscreen every day, thinking about the time of day that you're doing your outdoor activities, and using shade where you can. So it starts with modelling, and then it's about teaching your kids the same skills. With very young children under 6 months old, we don't advise sunscreen, we advise avoidance completely, so using shade and clothing to protect them. And then from there on upwards, it's about teaching and education of your children. I know a lot of parents say, you know, my teenager's not using sunscreen and they don't listen to me, and what should I do about it? It's a really hard thing. They do actually have to start to buy into the message themselves, and so talk about people that you know who've got skin cancer and skin cancer treatment, talk about prevention being the most effective way of doing it, and model really good sensible behaviour yourself. And if you keep going with those things, then more often than not they will start to pick up those habits and incorporate them into their own lifestyle, and that's the best gift that you can give your kids as a parent, right? One of the things in clinic is older patients always say to me, if only we'd known about sunscreen and sun safety when we were young. So that's what I tell my kids is that they do know about it, and the responsibility is on them to try and protect their skin. You have one skin for the rest of your life, so it's your best outfit. You better take care of it. Well, because New Zealand and Australia have such high rates of skin cancer, we're also driving some of the innovation and research into prevention and also treatment. So, I mean, we've talked a little bit about clothing. Clothing has become quite an innovative field for devising UPF 50 fabrics. Now, UPF refers to when clothing is giving sun protection, but it's just the same as SPF. The numbers kind of equate. So we've got some great new fabrics that are super lightweight. They wick moisture away from your skin. They don't feel warm, and they're really sort of coming to their fore in the adventure clothing market. Sunscreens, we've got some great New Zealand developed and Australia developed products for sunscreens that, in the olden days, if you had a factor 50 sunscreen, it was white paste and it looked dreadful. Nowadays, you've got super light formulations that are almost like milk on your skin. You've got clear formulations that are really quite good water resistance, and they really don't sting when they go in your eyes, which is a huge factor when you're surfing or at the beach or working hard and sweating. There's just about a sunscreen to suit everybody. So that's been great. That innovation has made sunscreen so much more tolerable when we're going to be wearing it every day. There is innovation in terms of AI and monitoring, and MoleMap has been a part of driving that with their own AI application, and the use of high-resolution total body photographs so that we can track and trace and pick up those new moles as they appear. So that's been really good. Dermoscopy, where we use the magnifiers to look into the skin, that's a relatively recent science that's come into being in the last 20 years, but we're making strides and driving forward with that kind of thing. And then treatments, and this is probably where most people know we've had some great changes recently with immunotherapy, so a particular type of treatment for advanced melanomas and other skin cancers. Now, we don't have the level of access that we want, but the results from trials and from patients who can access those treatments has been really encouraging, where people with advanced melanoma are seeing reduced rates of death from melanoma disease. And some of that research is led by the cancer research places in New Zealand and Australia. They're leading the world in that research. So we can be proud of the work that we're doing here in the Southern Hemisphere.